Hello everybody, I am Aditi Maji. I am majoring at psychology at Durgapur Women's College and currently doing my internship from Man and Mind Child Care Center. So today we are talking about personality and personality disorder. So what is personality? It is an individual unique trait that is common to everyone. So what is personality disorder? Personality disorder is an abnormal pattern of inner experience and thought process and behavior. So there are mainly 10 types of personality disorders according to DSM-5. So what are those types? So there are main 10 types of personality disorders. They are further divided into 3 clusters, cluster A, B and C. Cluster A includes 3 types, paranoid, schizoid and schizotypal. Paranoid people are always suspicious of others. They can't trust any people and they always be in guard. They always guard themselves. Then what are schizoid people? They are indifferent to any emotional response and they show no interest in relationships and whatsoever. And what are schizotypal personality disorders? Schizotypal people feels discomfort in any relationship. They think any relationships are messy, so they don't engage in any type of that. So they refrain from any social interaction. So what are cluster B personality disorders? Cluster B personality disorders involve being overly dramatic, impulsive and being emotional. There are 4 main types: antisocial, histrionic, narcissist and borderline. Who are antisocial personalities? Antisocial personalities are who lack conscience. They tend to break every social rule. They have a tendency of stealing, lying, manipulating people and they enjoy it. Who are borderline personalities? Borderline personalities are who have extremely negative self-image. And who are histrionic personalities? Histrionic personalities tend to self-harm themselves and try to get attention. And who are narcissists? Narcissists are people who are extremely selfish and totally full of themselves. Cluster C personality disorder. Cluster C personality disorder involves being anxious, fearful and avoidant. There are mainly 2 types, avoidant and dependent. Avoidant personality disorder means the people tends to avoid any risky behavior, any social interaction that will put them into risk situation. And dependent personality disorders are people who depends on others. They tend to think that they will need someone to survive. And these all personality disorders are disorders because they deviate from our social expectation and deviates from normal. They are totally excess behavior that does not add up in our society. So why personality disorder exists? We exactly don't know the reason. It can be from genetic or biological or societal issues. Like in schizoid and schizotypal personality disorder, these are more common in people with schizophrenia. As for BPD or borderline personality disorder, these can generate from childhood trauma or abuse. As for narcissism, they generate early in childhood from neglect in parenting. Parents usually give too much attention or praise the children for something they want and they give less attention to their emotional growth. So how to treat personality disorder? We exactly don't know how to treat personality disorder because it's too complex and their characteristics are so similar that it's hard to separate them. And secondly, people who have these disorders are mostly unaware that they have these wrong versions and they try to think that whatever they are doing, how their thought process works are actually right. So they don't ask for help. If we try applying some therapies like CBT or dialectical behavioral therapy, there is a small chance that they can be helped. And as for children, we can use many interventions. So that's it. I have tried to explain a small part of personality disorders. Thank you.